Hi, my name is Casey Arriaga. I am a clinician and team leader for education here at Windmill Wellness Ranch, which is a treatment center for addiction and mental health. And one of the many things that I get to do here that I love is working with families. I do our family workshop, and from time to time in the course of that, I get to work with kids around addiction. One of the things that I've really seen is that a lot of family members struggle with how to talk to their kids around addiction. I hear it in our clients, I hear it in family members, almost like they're trying to come up with some story they can tell the kids about what's happening, especially if it's their parent who is in early recovery here at Windmill. So one of the things that I've noticed is that kids pick up a lot more than we think they do. So we tell ourselves they don't really know what's happening, they're not really following what's going on, they're too young, they wouldn't get it. And I found that that's never actually true. I found that we can talk to kids in a straightforward and direct way at a level they can understand, but still telling the truth. So some of those tempting things to say, for instance, mommy's sick right now, or daddy's away on a work trip, that sort of thing. I think kids start to pick up that something's a little off in the story, that that's not really what's happening. And on top of that, we can give some kind of mixed messages around that, because kids might think, well, I get sick sometime. This isn't what's going to happen to me later, is it? Like if I get sick, am I going to go away for 60 days or something like that? So we don't want to give the wrong impression to the kids about what some of those words mean. So instead of that, I will encourage people to, in fact, talk in a straightforward way to their kids. So even younger kids, it's possible to say that, you know what, I'm running into a problem in my life. Something is getting in the way, and I want to be the best parent I can to you. And so I'm going to have to go away for a little bit to work on myself. And when I get back, I'm going to be an even better version of myself. And this does a couple of things. One, it is telling kids the truth, and I think that's an important thing to do. The second thing it's doing is it's actually setting up a family culture of growth. We know those kids are going to struggle someday, just like we all do. They may not have the same struggles, we hope, although we know that addiction also does run in families. There are cultural factors, there are genetic factors. They may in fact run into some of the same struggles. And if they know that their parent was able to seek help, then it makes it much easier for them perhaps to think that I could seek help or ask for help if I need it. And that can be a great thing within a family. So it's actually setting a great example along with telling your kids the truth. Sometimes, especially younger kids, they don't have a great reference for how long a period of time is. And it can be tempting to say to the kids, well, it's not going to be that long. But understand to the child that in fact it is going to be a long time. And we can be honest about that. This is probably going to feel like a long time. But another thing to recognize is that when somebody's in treatment, they can still have contact with their kids. So one of the things that we do here at Windmill, we have regular family visitation. Kids are welcome to come be part of that. I run a family workshop on the weekends, and kids are welcome to come and be part of that. We also facilitate video calls for our clients that have younger kids, and sometimes other clients will say, well, how come I don't get video calls with my girlfriend or something like that? We'll say, well, actually, believe it or not, the video calls are not for you, they're for the kids. We want those kids to still have contact with their parent, and again, to be able to see that example of somebody working on themselves and addressing their problems. It's a great thing to be able to teach kids early on. Now, the older the kids get, the more they can understand, more on an intellectual level, not just an emotional level, what's happening. So again, being able to talk to kids on an age-appropriate level, and I'll say just a small example from my own life. I grew up with a dad who had a problem with alcohol. So by the time I was probably 3 to 5 years old, I knew something was wrong, but no one in my family would talk about it. And because no one would talk about it, I had to make things up like all kids do, and like most kids, I thought things were about me. So I started to think to myself, maybe I'm doing something wrong. I wouldn't want to give a kid that impression these days, right? So being able to talk about what's really happening helps to remove that stigma and impression that maybe they're doing something wrong. And it also takes away that idea that they have that I know something's wrong and no one will talk about it. I know something's off with my parent. I know their behavior changes, the look in their eye changes, but no one will acknowledge it. That puts a kid in a really precarious position, and again, they can start to take that personally and start to develop psychological problems, even if they aren't dramatically displayed on the outside, that might blossom later. So one great way to be able to do that is, again, to tell kids the truth. Now, one example that I love to turn to around this kind of thing is Mr. Rogers. If you ever watched Mr. Rogers' Neighborhood, when I was a kid, I just thought it was a kid's program. When I went back and watched it as an adult, I thought, wow, this guy could talk about anything. He brought up all kinds of subjects that would normally be thought to be way too difficult to talk to kids about it. And what I found that I think we could all take away is that he was able to talk to kids with compassion and understanding and honesty in a straightforward way. He was able to admit his own mistakes where he didn't understand something, where he struggled with something, and that gave them permission to talk about things where they didn't understand and where they struggled, and to be able to express their emotions around it. That's a great approach to be able to take with your kids, whether they're your kids, your grandkids, your nieces and nephews, or just a child that you know of somebody who might be struggling with addiction. If they're in the middle of the active addiction, that kid really could use some support. And if somebody seeks treatment and they're in early recovery, we shouldn't assume that the kid now is okay because the parent's doing better. We know that that kid is still going to need support. So we offer some of that support while we're here, and we advocate for our clients to continue to get their kids support after they leave treatment. So maybe some specific ideas as kids are getting older. So for instance, a pre-adolescent child, maybe 10, 11, 12, somewhere in there, where they're getting a better intellectual understanding, but they still don't have a good grip on what's happening. We want to be able to talk to them again at an age-appropriate level. At that age, it's actually not too early to talk about the idea that someone might take a substance and it'll affect the way that they think, and that can become a habit or a compulsion. Now, we may not use big fancy words when we talk to kids, but being able to talk about examples that they can think of. Have you ever done something where you kind of wished you hadn't done it? Have you ever found yourself doing something where you think, this is a bad idea, but then you go ahead and do it anyway? Lots of kids can think of times that they've done that. Being able to talk about where a parent might struggle with that and it starts to take over their life, it's not too early to have that conversation. One thing to remember is that most kids who start into compulsive or addictive behavior start in as they're heading into adolescence. That's really kind of the danger zone in there for most of us. And adolescence can start as early as 8 to 10 years old. So sometimes your kid is experiencing some of these things, not necessarily their own addiction, but starting to notice some compulsive tendencies in themselves, recognize what it looks like in someone else, even if they're not experiencing it. They're able to wrap their head around it better. And at that age, we can really notice those differences in how one family or one individual is doing versus another. Now, as we move into more full-blown adolescence, as people are moving into their teenage years, they're going to run into drugs, including alcohol. They're going to see it in their friends. They're going to have it offered to them. We don't want to make it sound that it's acceptable and it's a good idea to do these things, but we want to talk to teenagers realistically, knowing they are going to experience them, and they may have experienced them before we ever brought the conversation up. So whether they're running into some issues themselves or seeing it in friends, if they haven't yet, they're going to. Being able to talk to them in a straightforward way, being able to talk about where a parent has struggled about that, and by the time they're teenagers, they can understand that these things may run in families. They've probably run into some compulsive behavior within themselves, even if it isn't addiction or it doesn't have anything to do with a drug or other mental health issue. But they're old enough to get these things and be able to talk about them in a fairly straightforward and adult way. And with adolescents, as with younger kids, it's really important to give them space to feel and struggle with the emotions that they do, and be honest with them about where you may feel and struggle with emotions yourself. Sometimes as parents, especially as kids are getting older, we can still fall into that temptation to pretend like we're all okay and everything's handled, when it's going to be obvious to the kid that that's not true. So let's just address what's really happening, talk about it in a straightforward way, give them an opportunity to do the same, and then be able to offer help if they're open to it. Sometimes teenagers aren't, but sometimes they are. And again, if we're able to model, hey, I'm going to see a therapist about this. I'm going to go to a recovery support group around this. Would you like some help around that? We just want to let you know that it's available. Even if they seem to ignore it or don't want it, they may still be taking it in and putting it in the hopper, and they may find that it's easier at a later date, even if they're not ready yet, to reach out for that help. And that could make a huge difference in a child's life. So the bottom line with working with kids around addiction and talking to them is to just be straightforward, honest, trust the process, enlist professional help where it's needed, and know that there is always hope and things can get better, and we're setting a good example for the next generation. Thanks for watching. We know that if you've seen this video, chances are someone you love is struggling with addiction, and we want to help. We have a free family course at windmillfamilycourse.com. Sign up to check out some of the most important topics that help family members around this struggle. Your family has hope.